Hi guys, my name is Dr. Rola Rabah. I'm an oral maxillofacial surgery resident, and today I'm going to take you on a day of IV sedations with me. This is a day in the life of a surgical resident. I am on my general surgery year, and so I'm going to do a full year of general surgery and 5 months of anesthesia training. This is super important because as oral maxillofacial surgeons, you have the ability to do IV sedation in your office, and in order to do IV sedation safely, you have to be able to know how to protect the airway, do emergency intubations, and be able to really understand anesthesia in order to make sure that you have the proper competence and confidence to run your own IV sedation in your private office. And so after 5 months of anesthesia training, I will basically have the ability to do this once I am done with my residency. And today I'm going to show you how I run my own IV sedation cases. These are cases that get scheduled in minor procedure rooms. IV sedation is a great option if you are really nervous, but you still need a minor procedure to be done. For example, if you needed your wisdom teeth removed, that could be a surgical procedure that makes people really nervous, and a lot of people just don't want to sit through that procedure. And in order to be more comfortable and be able to have the procedure done basically without pain, without remembering it, and without being completely aware, but you're still awake, protecting your own airway, you don't have to be put to sleep, you don't have to be intubated, IV sedation is the perfect solution for that. And so it's something that most oral surgeons get trained in and offer in their private offices. All right, you guys, so this is our fancy schmancy oral surgery anesthesia cart. So I come here the day before my patients are scheduled so that I can make sure that everything in these carts is exactly where I want them, everything is supplied, and everything is in stock, because we've got a ton of equipment that we have to use. And unlike when you're doing general anesthesia in the big operating room, where there's support staff and anesthesia techs that come in between every single case to make sure everything's stocked, this is more of our responsibility. So I have this organized the way I like it, which I actually really enjoy because I love organization and looking and making sure I have all of the right equipment and things are in the same right place. I have a very I'm a perfectionist and love this kind of stuff, so I don't really mind it, but I definitely check the day before because I don't want any disasters to happen at 7 a.m. when my patients are scheduled for a 7:30 surgery. So in this first drawer, it's all of my most commonly used stuff that I have organized. Syringes, different cc's. Have different syringes is because, like, if you're drawing up ketamine, you're not using very much of it, and so you're going to draw it up in a 1cc syringe. But if you're using Versed or fentanyl, then you can draw it up in a 3cc syringe, because you're generally giving about 2 cc's or something like that. And so I've got all of my syringes in here. I've got my labels in here in case my my electronic labels don't work. Usually I try to do it all electronically because it's super accurate, but just in case, I have to make sure that all of my drugs and solutions are labeled, and so I have backup labels here. I got my flushes and alcohol wipes. Everything I need to draw up my drugs is in this first drawer. My second drawer is all of my IV supplies, and so I've got some of my IV tubing, I've got flushes, I've got preps and my tuggies, and I've got some of the catheters here in the back, everything I would need to start an IV. A lot of times they do their IVs in pre-op, but sometimes I have to put in my own IVs. Here I have some of my anesthesia forms, and I have you can see I already started to prep some of my syringes. But I like to organize them by cases. So I have usually 3 cases in the morning, and so I have them organized all in there. And then this drawer has all of my monitors. This is a super important drawer. I try to keep it really nice and organized because all of the leads can get everywhere. But I've got my EKG leads that are going to monitor my patient's heart. I've got my pulse ox, and that gives me an idea of my patient's oxygenation statuses. I've got blood pressure cuffs. I've got nasal cannulas in here to give them oxygen, and I can monitor their CO2 as well. And so all of the really important monitors are in here. And then last, but certainly not least, is the last drawer, which kind of looks messy, but it's actually not, because I have this bundle pre-made so I can quickly grab it. This is my emergency airway bundle in case something bad happens, I'll go through this bundle. Hopefully it never does, but here I have a lot of my airway equipment. I have face masks, and I've got ET tubes. I've got my Max and Millers and lots of different blades in case I need to do an emergent intubation, which hopefully does not happen. A lot of the IV sedations that we do are on healthy young patients, and so we don't anticipate having to do an emergency intubation, but you never know, so you always have to be prepared. I have oral airways in here, lots of different things, and then I have this bundle that I check the day before and the morning of, and in between every case. I know it sounds very neurotic, but this is what's going to really make a difference if something goes wrong, and you have to be prepared because you're the anesthesia provider. So here I have a oral airway, I've got an ET tube, I've got a nasal airway, I've got a this is a Mac blade here that's clean and I've checked. I've got an LMA, so all of the things that I might need in order to very quickly and swiftly intubate a patient if I need to secure the airway. But again, hopefully that never happens. That generally does not. But you always have to be prepared for the worst. And so that's it. This is the whole cart. So I basically just checked it with you guys, and I will be ready to go tomorrow. The next thing that I'm going to do in order to prepare for my IV sedations is check all of my patient charts and look at their medical history and their medications and make sure that I've got everything that I need for tomorrow, and I'll print the anesthesia consents as well because I need to get their consent tomorrow. And so that's it. Since today is an earlier day than usual on anesthesia, I went and got coffee. So the first thing that I do once I get into the room is check all of my monitors. If I don't have all of my monitors hooked up correctly, then I have to call the techs to come down here and help me, because we absolutely cannot start a procedure with IV sedation without making sure that we have the patient's oxygenation status, we know their blood pressure and their heart rate. All of those things are extremely important to make sure that the patients are safe throughout the entire procedure. IV sedation is generally very safe, but you have to have someone there that's able to monitor the patient and make sure we correct anything that needs any sort of attention. And so that is the safest way to do it. So absolutely no procedures if we don't have all of our monitors hooked up to the patient and ready to go. The second priority is I get on the computer, I see who is here, I make sure I review their medical history and medications really quickly. Of course, I've done all of this prior. You should not be doing this the morning of the procedure. You should really know if your patients have something that require a different medication, or you avoiding a medication because of a certain medical history, or because they're on another medication that might interact with your anesthetic. Those are very rare, but you still want to make sure to look those over and get a sense of what your patient is like. And so the morning of, I'll just quickly review, and then I'll grab my consent and head up to the pre-op area where they're getting checked in by the pre-op nurses to get their consent for anesthesia and to talk to them a little bit about what IV sedation is like, what they should expect. It's really important to always communicate with your patients, let them know, hey, you're going to be awake enough that you're maintaining your airway, but sleepy enough where you do not remember your teeth being taken out, which is huge advantage to a lot of people. The room gets set up overnight, and so I just walk in and everything's in the right place. This is the sterile equipment that the oral surgeons will use. This is the dental chair that gets pulled into the room because of course the patient can't be on a typical hospital stretcher. They need to be sitting up for the procedure. And then my anesthesia cart that I showed you guys yesterday when I was prepping it. And the most important thing when you are in a procedure room where there's going to be anesthesia is your monitors. And so I've got all of my leads here. I just checked everything, turned on my monitors. I'm going to make sure that when a patient gets in, they have a blood pressure cuff on so I can get a blood pressure. I can hook them up to the pulse oximeter so I know that they're oxygenating well. And then the EKG leads will go on the patient. And these are the EKG leads. It's a little bit complicated. It looks like there's a ton of wiring, but it's actually super easy as long as you remember a mnemonic. So remember, this is the patient staring at you. I'll go over it super quickly on how you can place this really easily. If the patient is sitting down looking at you, then this is the patient's right side and this is the patient's left side. You've got 5 heart monitors here. You put these removable sticky things on there, And once you have that ready, you can stick them on the patient in the right spots. They don't have to be exact, but if you're somewhere in the right vicinity, you should be okay. And so the way I remember this is white goes on the right and snow goes over grass. And so you want to put your green on the right chest, and then your snow goes above the grass, so they go like this. And then on the left side, you've got 3 leads, and it's going to be smoke over fire. So we'll put your fire up here, smoke over fire, and then smoke over fire on the ground, and the ground will go on the lateral chest to get the apex of the heart. And so that's it, super easy. White is on the right and snow over grass, and then on the left you have smoke, which is the black, over fire on the ground, which is to the side there. So that's it. I put my EKG leads on my patient, my blood pressure cuff, and my pulse ox, and hook them up to the monitor, and then we'll be ready to get going with the procedure. Okay, so this is what our Pyxis looks like. This is the hospital system in order for us to be able to pull out our drugs. When you're on anesthesia, you're the only provider who can pull out your own drugs and administer them right away. Usually you have to go through pharmacy, and so I am going to log in and pull out some drugs. Once I sign in, pull out all my drugs, I can grab everything that I need. For IV sedation, we like to use the least amount of drugs possible. So we try to be very minimalistic, but I do draw some of my emergency medication as well as the medication that I'm going to be using. And then we have a label system, so it will safely label all of our syringes so that there are no mess-ups. Print out a really nice label for me so that I could do all of my syringes safely. This is a huge plus when things are automated, and then I can scan it in before I give the medication. Sometimes it takes a while to scan. Okay, so here's my next label. And last but not least, and we can briefly talk about some of the drugs that we use in IV sedation. Okay, so now I'm going to label my syringes and draw up these drugs. Again, different size syringes for different things. And so this is my drawing needle, so it's not very sharp to prevent you from getting cut. This is my midazolam. I always check the label before I draw it up. And once I check the label, then I label my syringe so that there's no confusion. It's to prevent any sort of error. So now I know that this is midazolam, which is also known as Versed, going into this needle. So I've checked my label against my drug. Pop the secure cap on. Off. Wipe the top with alcohol to make sure everything is nice and sterile, and then draw up my drug. Make sure I get everything. Pull out any bubbles. And get to the right, and that's it. And then I can administer this after I scan it, and that's how I have all my drugs. I also pull out a anesthesia emergency kit. This is a locked kit that gets stocked by pharmacy and has all of the emergency drugs that you would need, like atropine, esmolol, phenylephrine, ephedrine, lots of different drugs that you might need. This always stays in the room with us no matter what, to make sure that we have everything right on hand in case something were to happen, but usually nothing happens, so let's keep our fingers crossed that we never have to open this. So we just finished the first case. It took about 30 minutes to get 4 wisdom teeth out, which is good because the patient only had 30 minutes of IV sedation. You don't want to do IV sedation for too long, so I like when the procedures are short. I am now going to go and pull meds for the next patient and then go see them in pre-op and put all their monitors on them. So when you take patients to PACU, you have to check up on them, see how they're feeling. One of my patients is feeling a little bit nauseous, which is not super uncommon, so I just pulled out some Zofran and I'm going to give them some Toradol to take care of any post-op pain that they might have. But your biggest help with these cases is actually local anesthetic. So if they have good local, they shouldn't need too much pain medication. All right, you guys, that's it. Scrub caps off, which means I'm all done with the sedation cases for the day. I love IV sedation cases because we usually do anywhere between 3 to 4 cases and they get done super quickly. There's really quick recovery, which is the greatest part of IV sedation. A lot of times when you're doing general anesthesia, it takes a couple of hours in the recovery room for patients to wake up. And with IV sedation, it is much quicker. So it's very efficient, and then I have to go waste a lot of the narcotics. Narcotics need to be wasted, so someone has to witness me getting rid of anything that I didn't use. So my ketamine needs to be wasted, my fentanyl needs to be wasted, any sort of controlled substance needs to be wasted with a witness. So I have to go run and find someone with access to the Pyxis to help waste with me. I'm done for the day. So when I get home, I'll talk to you guys a little bit more about IV sedation and what kind of drugs I commonly use. All right, you guys, so I'm back home in my cozy loungewear and I have the rest of the day to enjoy. So I'm really excited about this awesome schedule that I have on anesthesia. But also I figured I will go quickly over some of the most commonly used drugs for IV sedation. Just keep in mind, these are the drugs that I use in my institution based on my institution's preferences, based on my attendings' preferences. So if you go to a different oral surgeon, they might use different drugs, and that's totally normal because there are tons of drugs that you can use in order to achieve the same outcome, which is making the patient comfortable enough to have the procedure done. You just want to eliminate that fear, but also do it in a safe manner. And so the drugs that we use most commonly are drugs that are going to give you different things. So you want an anxiolytic, so a drug that's going to reduce a patient's anxiety. You want a drug that can maybe give you some amnesia, meaning that you are not going to remember the procedure or the pre-op or even a little bit of the recovery. And you want a drug to take care of pain as well. And so that drug is going to make sure that the patient is nice and comfortable doing the procedure. And of course, you want a drug that's going to give you some sedation, so some anesthesia. And in order to achieve all of that, what we commonly use is midazolam, which is also known as Versed. That is a benzodiazepine that is an anxiolytic and it can give you amnesia. So 2 different things that you want in IV sedation. And that's really great because a lot of times patients will wake up, and even though during the procedure, again, IV sedation, you're not completely asleep, you don't have a breathing tube, you're awake, you can talk, and sometimes you can respond as well to the surgeon, but you will not remember any of that. So you're breathing on your own, the surgeon will tell you to open nice and wide, and a lot of times patients do, but at the end, they will not remember any of that. They won't remember talking to you. They won't remember going into the room because of the amnesia effects of Versed. Another drug that we use that has similar properties is ketamine. It works in a different way. It's not a benzodiazepine. But it also gives you dissociative amnesia, and it also gives you a really good side effect for anxiolytic as well. And so ketamine could also be used in conjunction with Versed in order to achieve the same goals. A lot of times they're used together in order to reduce any of the unwanted side effects of ketamine. And so those are 2 commonly used drugs. Another drug that you want on board is some sort of narcotics. Sometimes narcotics are really great because they are what's going to take care of your pain. Remember what I said though, your biggest help during IV sedation is the local anesthetic. So you want to give just enough drug to get the surgeon to administer really good local anesthetic. But once the local anesthetic is administered, the patient should be numb and they should not really feel pain. And so you don't want to give actually too much narcotic, but a lot of commonly used narcotics are Dilaudid or fentanyl, and that really takes care of some of the pain that the patient might experience initially when they're getting the local anesthetic. But also fentanyl can help get the patient nice and comfortable and get them to lose their awareness as well. And so that is a really good drug, and a lot of times we'll use a little bit of fentanyl as well. And finally, one of the drugs that is commonly used for IV sedation is propofol. Propofol is a drug that you also want to use in conjunction with Versed and fentanyl. However, you want to be really careful with propofol because it needs to be administered very carefully, because you have to be really able to monitor the patient, because they can quickly wake up from propofol and they can quickly become apneic. So it's a little bit trickier to titrate, and you have to be really comfortable using propofol. But the advantages of propofol is that people can go to sleep right away and wake up right away. So it's quick onset, quick offset. But again, it requires a lot of monitoring. So sometimes people use propofol as an adjunct, a little bit of it, in case the procedure is taking longer than expected and that they want the patient to still be unaware. But it's, not really recommended to use for long durations, long procedures without anything else, unless you have a dedicated nurse anesthetist or anesthesiologist that's going to be monitoring the patient as well as administering the propofol. But some people are really comfortable with propofol and do use propofol. And so I just decided to mention it since it's a very common drug to be used in IV sedation or MAC cases. And so those are kind of the most common drugs. There's tons of different drugs that you can use. There's drugs in the same classes, like same classes of benzodiazepines or narcotics that can be used, or just different names. Lots of different things that could be used while you are doing IV sedation. But again, it's going to depend on the surgeon. It's going to depend on the facility, where you are, and all of that stuff. So I hope you guys found this helpful. That's just a quick overview, but of course you need to be on anesthesia for months and months and months to get really good at IV sedation. And at the end of the day, IV sedation is quite safe if you are with an experienced provider and someone who is well trained in it. And so it's a great option if you are really nervous but still need a minor procedure to be performed by an oral surgeon. And we are really lucky as oral surgeons to be able to do in-office IV sedation. Not a lot of providers can do that other than anesthesiologists. And so we are super lucky, and don't take it for granted. Let me know if you want other videos and what other things you want to see me do while I'm on anesthesia. Make sure you comment below. That's the best way for me to find out what you want to see from this channel. Don't forget, you guys, to subscribe, because I do drop weekly videos, so you want to be the first to know when something comes out. And if you enjoyed this vlog style, don't forget to go to Instagram and follow me at 15 Blades, because I post like this pretty much daily on my story, and you can really indulge in the life of a surgical resident, which isn't always exciting, but it is something different. And so don't forget to go to Instagram and give me a follow. Subscribe to this channel, like this video, comment below, and I'll see you guys next time. Bye.